So the
talk about,
cancer is a little tricky because in the United States of America, that even it's almost like a law that cancer can only be treated with chemotherapy, surgery, or radiation therapy. Anything else is not looked kindly by the conventional medical system. Yeah. So what LDN, it's very interesting because the original study by Dr. Zagon and Dr. Bihari is that they had a mouse that they injected, I think it was a lymphoma, and that then the mouse develops lymphoma and dies. So they divided the mouse into two groups. One, they injected endorphin, beta endorphin, and then the other one, saline, and then they gave them lymphoma. So the saline mouse all died. The LDN mouse, 50% did not develop cancer, the lymphoma, and the 50% lived with lymphoma. So then that was one-time injection, and from there, it was surmised that LDN, which will increase the beta endorphins, will be useful for treating cancer. So Dr. Bihari he's a pioneer in LDN, started treating patients with HIV, but then moved on to treating patients with cancer. Now, after 40 years or so, we have now patients, doctors like Dr. Bergson in New Mexico, who has a protocol. He has an IV injection of alpha lipoic acid, which lowers blood sugar, combined with low dose naltrexone, combined with lifestyle and supplements that have reliable, meaning repeatable results with end-stage pancreatic cancer patients surviving into years, which is really amazing. Because,
unheard of. Yeah.
The stage 4 pancreatic cancer patients, the survival rate anticipated is about 6 months or less, plus minus. But these patients are lasting longer. So I have recommended, and having worked in cancer centers and academic centers, what I tell them is that if you're stage 1 and 2, and even 3, if there's evidence, go with the evidence. If you're stage 4 and there's no more evidence, then use all the tools. And usually oncologists, when they realize that there's no more reliable tools they can offer, there's always more things they can do, but they're not evidence-based, outcome-based. They're just contributing to that. So
more chemotherapy.
And LDN combined with other treatments that increase endorphins, at least in my practice, I've seen patients' lives lengthened, which is fantastic.
Wow.
So
that's fascinating.
Yeah, so that is, I don't say it cures cancer, but I think that it has a role, especially in stage 4 cancer patients, because MD Anderson says that they want to turn cancer into chronic disease. I think LDN with some of the other endorphin increasing treatments have a role for stage 4 cancer patients. And if it is good for stage 4 cancer patients, it may also be useful for all cancer patients. But
that's very fascinating. Is there any cancer aside from pancreatic that you know that's in the literature that has been helpful for, or?
The main issue is that a lot of these trials are not randomized control trials. They are more case. He's in case series. So as a scientist, you're aware that the process of science is it takes a while. Like one of my teachers who taught me how to treat dry mouth, xerostomia, and that it took probably almost 30 years for it to start from a protocol that he developed, case series study, to recently completed MD Anderson supported 3 multi-center trial study, which confirmed its effect. So you almost need the 3 decades to make that happen, unless you're in the right place, right time, with right resources.
Yeah, it's so time consuming, and money involved as well.
Yeah.
So that's very fascinating.